What many people fail to realize is that the aging process doesn't just affect our appearance, strength, or memory. It deeply alters the way we sleep, and this change, though subtle, can trigger a cascade of physical and mental health issues with devastating consequences. Contrary to the popular belief that older adults need less sleep, the truth is that the aging body still requires the same 7 to 8 hours of rest each night. What changes is the body's ability to sustain deep, uninterrupted sleep, and that's precisely where the danger lies. Recent studies by the National Sleep Foundation reveal that sleep architecture, the way our sleep is structured in different phases, changes significantly after the age of 60. Deep sleep, also known as stage N3, which is essential for cellular repair, memory consolidation, and hormonal balance, is drastically reduced in older age. And with less deep sleep, the body recovers less. Our circadian rhythm, the body's internal clock, also becomes disrupted with age. Many seniors begin going to bed and waking up earlier, a condition known in scientific literature as advanced sleep phase. This means the body starts releasing melatonin before nightfall, triggering drowsiness early in the evening, but also causing people to wake up much earlier, often around 4 or 5 a.m. The problem is that these extra hours awake in the early morning are not typically filled with energy or productivity, but rather accumulated fatigue, irritability, and daytime sleepiness, all of which seriously affect quality of life. Data from the National Institutes of Health, NIH, show that up to 70% of adults over the age of 65 report some type of sleep disturbance, ranging from difficulty falling asleep to frequent awakenings throughout the night. Another key factor that affects sleep quality as we age is the growing presence of chronic illnesses and the continuous use of medications. High blood pressure, diabetes, arthritis, heart disease, respiratory problems, and even neurological disorders like Parkinson's all impact the body's ability to sleep. Additionally, many medications commonly prescribed to older adults, such as diuretics, antidepressants, beta blockers, and corticosteroids, directly interfere with the sleep cycle. These drugs can cause insomnia, nighttime restlessness, or increase the urge to urinate during the night. Every time a senior has to get up during the night, not only is their rest disrupted, but their risk of falls and domestic accidents also increases, an issue we'll explore in greater depth later in this video. On top of that, we must also consider the impact of emotional and social changes. Grieving the loss of loved ones, loneliness, lack of mental stimulation, and even having too much idle time during the day can contribute to a heightened state of nighttime alertness. A restless mind, combined with low levels of physical activity and insufficient exposure to natural sunlight, further reduces sleep quality. Melatonin, the hormone responsible for sleep, is produced in optimal amounts only in darkness. Yet many elderly individuals spend most of their time indoors under artificial lighting, which disrupts the natural production of melatonin. Studies from Stanford University have shown that seniors exposed to at least 1 hour of natural light per day experience significant improvements in both the duration and depth of their nighttime sleep, proving that sunlight is just as vital as any medication in regulating healthy sleep. Still, despite all this evidence, insomnia is often normalized in old age, treated as a natural burden of getting older, which is a critical mistake. Ignoring sleep health has been directly linked to a wide range of severe consequences: increased risk of falls, heart attacks, strokes, neurodegenerative diseases, and even early death. Poor sleep is not a minor inconvenience. It's a systemic risk factor capable of destabilizing the entire body. Acknowledging that sleep changes over time is just the first step, but what matters most is understanding that these changes demand adaptation, medical attention, proper care, and above all, reliable information. Exactly the kind you'll find in this video. In the coming minutes, we'll reveal exactly how poor sleep impacts the body from within. You'll learn what happens to the heart, the brain, the immune system, and your real risk of accidents and serious diseases. We'll show you how science is uncovering more and more evidence that sleeping well is much more than simply resting. It is a powerful natural medicine against premature aging and the chronic conditions that claim the most lives after age 60. Get ready to see sleep from a whole new perspective, the perspective of someone who wants to live longer with health, vitality, and clarity until the very end. Poor sleep isn't just tiring, it's biologically destructive. When the body endures sleepless nights, an internal chain reaction is triggered, affecting virtually every vital system in the body. And this is even more critical after age 60, when the body's ability to repair, regenerate, and compensate is significantly diminished. Contrary to what many believe, sleep is not a time of inactivity. It's a highly active, complex, and essential biological process for both physical and mental balance. During deep sleep, especially in stage N3, the body lowers heart rate, stabilizes blood pressure, regulates core temperature, and activates the immune system. When this phase is interrupted or shortened, which is common in older adults, all of these regulatory processes become impaired. The first measurable consequence of a poor night's sleep is an increase in cortisol levels, the primary stress hormone. Excess cortisol acts like a silent saboteur. It raises blood sugar levels, disrupts metabolism, promotes the accumulation of abdominal fat, and increases blood pressure. Studies published in the American Journal of Hypertension show that seniors with fragmented sleep patterns face up to 30% higher risk of developing chronic hypertension, even if they maintain a healthy diet and regular exercise. Furthermore, elevated nighttime cortisol interferes with insulin production, contributing to insulin resistance and worsening pre-diabetic and type 2 diabetes conditions already widespread in individuals over 60. The cardiovascular system is another critical area severely affected by poor sleep. When we don't sleep well, the heart doesn't get the chance to slow down, keeping the body in a prolonged state of artificial alertness. Heart rate remains high, blood pressure fails to drop as it should, and as a result, the walls of the blood vessels sustain repeated micro-injuries. Over time, these tiny injuries accumulate, paving the way for plaque buildup, atherosclerosis, and drastically increasing the risk of heart attacks and strokes. A meta-analysis published by the Journal of the American College of Cardiology in 2021, with data from over 1 million elderly participants, found that individuals with chronic insomnia face a 45% higher risk of experiencing a major cardiac event. And this risk applies not just to those who sleep too little, but also to those whose sleep is poor in quality and frequently interrupted. But it's not only the heart that suffers, the brain is also significantly impacted. Sleep is essential for memory processing, learning consolidation, and the elimination of toxic waste from the brain. When sleep is fragmented, the lymphatic system, the brain's internal cleaning mechanism, fails to effectively remove beta-amyloid proteins, which are directly linked to the development of Alzheimer's disease. Research from the University of Rochester has shown that even a single night of poor sleep can reduce the efficiency of this brain-cleaning process by more than 60%. Now imagine that happening night after night, year after year. The result is a buildup of toxins that undermines memory, reasoning, and mental clarity. In addition, poor sleep throws off the balance of appetite-regulating hormones, ghrelin and leptin. When we sleep too little or too poorly, ghrelin, which triggers hunger, increases while leptin, which signals satiety, decreases. This leads to intense cravings, especially for sweets and carbohydrates, encouraging weight gain, abdominal obesity, and placing even more strain on the cardiovascular system. For seniors, this cycle is even more dangerous, as metabolism is naturally slower, and excess weight is closely linked to reduced mobility, worsening sleep apnea, and a higher risk of falls. Finally, fragmented sleep disrupts the production of anabolic hormones, like testosterone and growth hormone, GH, both essential for maintaining muscle mass. Over time, muscle loss becomes clearly visible in sleep-deprived older adults. They become frailer, struggle to stand up, walk, maintain balance, and perform daily tasks. This condition is known as sarcopenia, and its progression is directly associated with a higher risk of falls, fractures, and even loss of independence. In short, poor sleep is not a superficial inconvenience. It's a systemic problem, a kind of slow poison that silently wears down the heart, brain, metabolism, muscles, and immune system. Every night of missed or poor quality sleep isn't just a lost night. It's a physiological debt the body will repay with interest in the form of disease, chronic fatigue, and accelerated aging. And for those over 60, recovery time is shorter, the margin for error is narrower, and the consequences are more severe. In the upcoming segments, we'll explore how poor sleep can become the true trigger for dangerous falls, domestic accidents, and even silent heart attacks in the middle of the night. Imagine waking up in the morning, getting out of bed, and within 5 minutes, feeling a slight imbalance, tripping over a rug and falling to the floor. For many older adults, this isn't just a hypothetical scenario, it's a constant, invisible, and dangerous reality. And in many cases, it begins the night before with shallow, fragmented, or insufficient sleep. The human brain relies on sleep to restore itself, and that's not a metaphor. During the night, specific regions of the brain reduce their activity to reorganize memories, clear out toxic waste, and re-establish neural connections essential for reasoning, motor coordination, and reaction time. When this process fails, as it often does in older individuals who sleep poorly, the result is a brain that's slow, confused, and impaired in judgment, attention, and balance. Research from the National Institute on Aging shows that seniors with fragmented sleep or chronic insomnia are up to 2.6 times more likely to experience falls compared to those who sleep well. The explanation is clear: sleep deprivation reduces sustained attention and slows visual and spatial processing, precisely the functions that help the brain detect obstacles, react to environmental changes, and keep the body steady. Furthermore, poor sleep interferes with the activation of the cerebellum, the area responsible for fine motor coordination, and the hippocampus, which manages spatial orientation. This means the body may appear physically capable, but is neurologically vulnerable, operating like a frozen computer system, slow to respond, unstable under pressure, and prone to crashes. Another major contributor is the state of mental confusion upon waking, known as sleep inertia. In older adults, this confusion can last significantly longer than in younger people, especially when sleep is abruptly interrupted, for example, by a nighttime trip to the bathroom. During sleep inertia, a person may feel awake, but their brain hasn't fully resumed cognitive functioning. And it's in these moments, when seniors get up quickly or inattentively, that accidents often occur. A study published in Sleep Health analyzed over 11,000 hospital admissions due to falls and found that approximately 40% of those incidents occurred in the early morning hours, with a clear correlation to poor sleep quality the night before. But it's not just falls that become more frequent. Prolonged mental confusion can also mimic symptoms of dementia. Many seniors who sleep poorly spend their days forgetting simple tasks, mixing up names, losing objects, and displaying irritability. Family members, alarmed, may suspect Alzheimer's or another serious neurological condition, when in fact, the culprit is a brain overwhelmed by chronic sleep deprivation. Research from the Rush Alzheimer's Disease Center has shown that sleep disorders accelerate cognitive decline even in individuals without a family history of dementia. And for those with a genetic predisposition, poor sleep acts as a catalyst for neuron loss, triggering symptoms years earlier than expected. The situation worsens when we factor in the widespread use of sleep medications. Many elderly people without medical guidance turn to benzodiazepines or other sedatives, thinking they're solving the problem. But in practice, the opposite occurs. These substances induce artificial low-quality sleep, suppressing the most restorative phases of the sleep cycle and causing residual drowsiness throughout the next day. This impairs mental clarity and, ironically, increases the risk of falls, confusion, and loss of independence. Both the European Medicines Agency and the FDA have issued formal warnings against the prolonged use of these drugs in older populations for precisely these reasons. Beyond the physical and neurological risks, there's also a profound emotional toll. Poor sleep leads to irritability, anxiety, and a sense of personal failure. Seniors begin avoiding basic activities, going outside, walking, even stepping up a stair, out of fear of falling or getting hurt. This leads to isolation, depression, and a vicious cycle where fear worsens sleep, and poor sleep intensifies fear. In this context, the loss of autonomy isn't just caused by falls, but also by self-imposed limitations fueled by insecurity. That's why understanding sleep as a vital component of neuromuscular and cognitive balance is essential to preventing accidents. It's not enough to install grab bars in bathrooms or remove loose rugs. Though these are helpful measures, we must investigate the root cause of falls, which often lies in the pillow, or rather, in the absence of restorative sleep. A tired brain is as dangerous as a slippery floor. If ignored, it can turn small forgetfulness into serious confusion and minor stumbles into life-changing accidents. In the coming minutes, we'll reveal how the heart, too, suffers in silence, and how poor sleep can trigger fatal nighttime heart attacks, strokes, and dangerous arrhythmias that might be entirely preventable with a single good night's rest. Prepare yourself to discover how sleep is not just rest. It is the true foundation of cardiovascular health. The heart is a machine that never stops. Even while we sleep, it keeps beating, pumping blood, and sustaining life in every cell of the body. But what few people realize is that sleep is the only time when the heart truly rests, and when that rest doesn't happen, the damage is deep and silent. During deep sleep, heart rate slows, blood pressure stabilizes, and the sympathetic nervous system, which keeps us alert, powers down. This slowdown allows the heart to reduce its workload, conserve energy, avoid oxidative stress, and prevent inflammation. But when sleep is interrupted, insufficient, or poor in quality, this entire mechanism is sabotaged. The heart continues to operate in a state of alertness, as if the body was still awake, and night after night, this can be fatal. One of the most robust studies on this connection was published by the Journal of the American College of Cardiology, involving over 1 million participants followed for more than a decade. The findings were clear. Older adults who sleep less than 6 hours per night or suffer from chronic insomnia have up to a 45% higher risk of suffering an acute myocardial infarction, even when controlling for other risk factors like smoking, obesity, and high cholesterol. Insomnia, therefore, is not a harmless symptom. It's an independent cardiovascular risk factor, with impact comparable to chronic conditions such as hypertension and diabetes. But why does this happen? The answer lies in the activity of the autonomic nervous system. Poor sleep leads to overactivation of the sympathetic system, keeping the body in a constant state of alert. This results in tachycardia, elevated blood pressure, and excessive contraction of blood vessels, creating the perfect conditions for clot formation and rupture of arterial plaques. These processes are direct triggers for heart attacks and strokes. Furthermore, sleep deprivation impairs the nocturnal release of nitric oxide, a substance essential for blood vessel dilation and protection of the endothelium, the inner lining of the arteries. Without this protection, arteries age faster and become more vulnerable to blockage. Here's another alarming fact. The risk of sudden cardiac death is significantly higher during the early morning hours, particularly between 5 and 7 a.m. Coincidentally, this is when the body completes the final sleep cycle and experiences a natural spike in cortisol and blood pressure. If the older adult has had a poor night's sleep, this morning surge becomes a dangerous trigger. The heart, already strained and lacking recovery time, may not withstand the transition from rest to wakefulness. That's why so many fatal heart attacks happen at dawn, and many could be prevented if the person had experienced deep, uninterrupted sleep. Obstructive sleep apnea, a disorder highly prevalent in older adults, also plays a critical role. During apnea episodes, breathing stops repeatedly throughout the night, drastically reducing oxygen levels and causing frequent micro-awakenings. Each time this occurs, the heart must accelerate to compensate for the oxygen shortfall. Now imagine this happening 40, 50, even 60 times per hour. The cardiovascular impact is devastating. Elevated pulmonary pressure, risk of severe arrhythmias, ventricular hypertrophy, and heart failure. In fact, untreated sleep apnea is present in up to 70% of resistant hypertension cases in seniors, according to studies published in the European Respiratory Journal. Beyond heart attacks, poor sleep quality is directly linked to a higher risk of stroke. Sleep disruption affects blood viscosity, increases platelet aggregation, and promotes inflammation of arterial walls, all ideal conditions for clot formation that can block brain arteries. A study from Johns Hopkins University, involving over 150,000 older adults, found that insomnia increases the risk of ischemic stroke by 25% and hemorrhagic stroke by 18%. Given all this evidence, it's clear that sleep is one of the most powerful natural cardioprotectors available to the human body, especially after age 60. It costs nothing. It requires no prescription. It has no side effects. It simply needs to be respected. Yet it remains neglected in many routine health assessments for older adults. While blood pressure, cholesterol, glucose, and weight are regularly measured, few ask the question, "How's your sleep?" A question that could genuinely save lives. Sleeping well means allowing the heart to rest, the vessels to relax, the pressure to normalize, and the body to begin a silent but vital repair process. Ignoring sleep is forcing the heart to work overtime, and no engine, no matter how strong, can run forever without rest. In the next segments, we'll explore how sleep apnea, this common yet underdiagnosed disorder, is silently killing thousands of seniors every year. Get ready to uncover the invisible disease that robs sleep, sabotages the heart, and goes unnoticed for decades. Imagine that during the night, without realizing it, your body stops breathing. For 10 seconds, then 20, then 30, and this happens dozens, sometimes hundreds, of times in a single night. While you believe you're resting, your brain is fighting to survive. This is the reality of obstructive sleep apnea, a common, silent, and devastating disorder, especially in adults over the age of 60. And the reason it's so dangerous is simple. It rarely shows clear signs, is almost never diagnosed, and when left untreated, it dramatically increases the risk of heart attack, stroke, resistant hypertension, type 2 diabetes, depression, and even sudden death. We're talking about a true invisible epidemic, hiding in the night and deteriorating health day after day. Sleep apnea occurs when the muscles in the throat relax too much during sleep, leading to the partial or complete collapse of the upper airways. This blocks the flow of air, causing repeated pauses in breathing. The brain, detecting the drop in oxygen levels, sends an emergency signal, triggering a micro-awakening, which the person often doesn't even notice, just to resume breathing. However, each micro-awakening disrupts the natural sleep cycle, preventing the body from entering its most restorative phases. The result is that, even after 7 or 8 hours in bed, the individual wakes up tired, with a sense of non-restorative sleep, headaches, dry mouth, and daytime fatigue. Older adults are among the most vulnerable to sleep apnea. With aging, the tissues of the throat become stiffer, muscle tone decreases, and the anatomical structure of the pharynx changes, all of which contribute to airway collapse during sleep. In addition, many age-related factors increase the risk even further. Weight gain, use of sedatives, alcohol consumption, hormonal changes, and chronic respiratory diseases. Studies from the American Journal of Respiratory and Critical Care Medicine report that up to 50% of men and 30% of women over age 65 have some degree of sleep apnea, and more than half of these cases go undiagnosed. The consequences go far beyond loud snoring or daytime tiredness. Each apnea episode is, in essence, a small hypoxic crisis, a disruption in oxygen supply to the brain and heart. This causes spikes in blood pressure, intense adrenaline release, and increased heart rate. The repetition of these events creates a state of chronic stress for the cardiovascular system, contributing to resistant hypertension, arrhythmias, heart failure, and strokes. In severe cases, sleep apnea is linked to sudden death during sleep, especially among elderly individuals with pre-existing heart conditions. Apnea also affects the brain directly. Disruption of deep sleep impairs memory consolidation and is strongly linked to accelerated cognitive decline. Research from the University of California shows that seniors with untreated apnea are 70% more likely to develop early symptoms of dementia. Additionally, repetitive oxygen deprivation leads to atrophy in brain areas responsible for language, spatial orientation, and logical reasoning, compromising not only memory but also functional independence. Another alarming aspect is the link between sleep apnea and household falls. Because sleep is interrupted repeatedly, the person wakes up drowsy, disoriented, and with slowed reflexes. This impacts balance, attention, and motor coordination. A European study of over 9,000 elderly participants showed that sleep apnea patients are up to 3 times more likely to experience nighttime falls, especially when getting up to use the bathroom. And notably, many of these falls occur without any obstacles present. simply due to the loss of stability caused by sleep deprivation. Diagnosing sleep apnea is simple, but rarely pursued in older adults. It is done through polysomnography, a test that monitors brain activity, breathing movements, and heart rate during sleep. Once diagnosed, treatment may involve steps like weight loss, reducing sedative use, positional therapy, and most importantly, using a CPAP machine, which delivers continuous positive airway pressure to keep airways open throughout the night. Studies show that consistent CPAP use drastically reduces cardiovascular risk and improves quality of life within weeks. However, one of the biggest obstacles to early diagnosis is the normalization of snoring. Many seniors and their families view snoring as normal, just part of aging, or a harmless noise. But loud, irregular snoring with pauses and gasping is a serious red flag. It's the body shouting that it's not breathing properly. Ignoring this signal can be costly. It can cost memory, autonomy, or even life itself. Sleeping poorly is dangerous, but sleeping without breathing is lethal. And when sleep apnea is identified and treated, it can mean a complete turnaround in an elderly person's health. Better mood, increased energy, normalized blood pressure, sharper memory, and most importantly, saved lives. In the next section, we'll examine how poor sleep affects another vital system, the metabolism, and how it becomes an invisible ally of diabetes, abdominal fat, and insulin resistance. Get ready to understand why poor sleep leads to weight gain, chronic illness, and silent bodily disruption. The relationship between poor sleep and increased blood glucose is as direct as it is dangerous, and unfortunately, still underestimated by millions around the world, especially in later life. Type 2 diabetes, one of the most prevalent chronic diseases among the elderly, is rooted in insulin imbalance, excess circulating sugar in the bloodstream, and low-grade systemic inflammation. And sleep, or rather poor quality sleep, acts as a silent accelerator of all these factors simultaneously. Even a few nights of poor rest can already begin to show signs of glycemic dysregulation. And for those with genetic predisposition or poor dietary habits, the impact can be explosive, a true physiological trigger for the onset or worsening of diabetes. Studies conducted by Harvard Medical School and published in Diabetologia show that adults who sleep fewer than 6 hours per night experience a reduction of up to 30% in insulin sensitivity, even in young, healthy individuals. Now imagine this scenario in an aging body, naturally more vulnerable and with a slower metabolism. The result is a true glycemic storm. When sleep is insufficient, insulin receptors, especially in the muscles and liver, become less responsive, forcing the pancreas to produce more insulin to regulate glucose levels. Over time, this extra effort exhausts the pancreatic beta cells, ultimately leading to the onset of type 2 diabetes. In addition, poor sleep significantly elevates levels of cortisol, the stress hormone. Excess cortisol is highly diabetogenic. It stimulates glucose release from the liver, reduces glucose uptake by cells, and promotes the accumulation of visceral fat, the most inflammatory and dangerous type. This fat, which builds up around abdominal organs, not only worsens insulin resistance, but also fuels a chronic inflammatory cycle that slowly dismantles the body's metabolic balance. In seniors, this process accelerates further, as tissue regeneration and hormonal control are already naturally diminished. Another crucial factor, sleep deprivation, disrupts hunger-related hormones. Ghrelin, which increases appetite, rises. Leptin, which signals satiety to the brain, drops. The result? Seniors feel hungrier, particularly craving sweets, pasta, and refined carbs, the worst enemies of glycemic control. It's no coincidence that people who sleep poorly tend to snack late at night or even in the early hours, consuming high-calorie foods to offset fatigue. This creates a vicious cycle in which poor sleep leads to hunger, which leads to overeating, which spikes blood sugar, which then disrupts sleep again. A destructive loop that, without intervention, leads to difficult-to-control diabetes. The connection also works in reverse. Uncontrolled diabetes itself disrupts sleep quality. High blood glucose levels cause polyuria, the need to urinate frequently, leading to multiple night awakenings. Additionally, diabetic neuropathy causes pain, tingling, and burning in the legs, especially at night, making it difficult to fall and stay asleep. In more advanced cases, diabetes can also trigger sleep apnea, further worsening the condition. Studies from the Sleep and Breathing Journal indicate that approximately 60% of type 2 diabetics over age 65 suffer from an undiagnosed sleep-related breathing disorder. The final consequence of all this is systemic. A senior with poor sleep and uncontrolled diabetes begins to experience symptoms like chronic fatigue, muscle loss, vision changes, memory lapses, irritability, and a constant state of inflammation. This leads to an increased risk of cardiovascular disease, opportunistic infections, kidney problems, and even amputations in advanced stages. And all of it could be avoided or drastically reduced with a simple, natural, and powerful intervention: better sleep, consistently and deeply. Fortunately, science shows that improving sleep can reverse part of this process. In a clinical trial conducted at the University of Chicago, elderly pre-diabetic patients who underwent a structured sleep hygiene program, including consistent routines, warm baths, avoiding screens at night, and a dark sleeping environment, showed significant improvements in fasting blood glucose and A1C levels in just 8 weeks, without any changes to diet or physical activity. This proves that quality sleep is not just a supporting player, it is a central protagonist in the control of type 2 diabetes. In the next segment, we'll explore how this same poor sleep weakens the body's natural defenses, directly compromising the immune system in older adults and increasing the risk of infections like flu, pneumonia, and even shingles. Get ready to understand why just one bad night of sleep can leave your body wide open to illness. The immune system is the body's front line against everything that threatens our health: viruses, bacteria, fungi, defective cells, and even cancer. But what few people, especially seniors, realize is that this powerful natural barrier depends on sleep to function at its best. During deep sleep, a series of vital immune processes are activated. The body increases the production of T lymphocytes, natural killer NK cells, anti-inflammatory cytokines, and specific antibodies. It's as if the immune system goes into turbo mode while the rest of the body rests. But when that rest is interrupted or fragmented, immune activity drops sharply, leaving the body exposed to external invaders and vulnerable to serious infections, particularly after age 60, when immunity is already naturally weakened. Studies from the National Institutes of Health and the University of Lübeck in Germany have shown that just one night of less than 5 hours of sleep can reduce NK cell activity by up to 70%, and NK cells are responsible for identifying and destroying infected or abnormal cells. This means that after just one poor night's sleep, the body starts the day more vulnerable to colds, flu, pneumonia, herpes, and even tumor growth. In older adults, this vulnerability is amplified, as the immune system is already operating at a reduced rate, a phenomenon known as immunosenescence. Lack of sleep accelerates this decline further, turning minor infections into serious complications with high risk of hospitalization and death. One of the most well-documented examples is the relationship between sleep and the flu. A study published in JAMA Internal Medicine monitored over 150 adults deliberately exposed to the influenza virus. Those who slept fewer than 6 hours per night were 4 times more likely to develop severe flu symptoms compared to those who slept over 7 hours. And it's not just about catching the illness. The response to vaccines is also compromised. In another study conducted at the University of California, sleep-deprived seniors produced 50% fewer antibodies after flu vaccination, meaning the body failed to respond properly, even with the vaccine. The situation is even more critical with respiratory infections, such as pneumonia, one of the leading causes of hospitalization and death among elderly people in Brazil. When seniors sleep poorly, production of pro-inflammatory cytokines like interleukin-6 rises, while regulatory cytokines, the ones that balance the immune response, decrease. This imbalance makes it easier for infections to take hold and harder for the body to fight them off, leading to exaggerated inflammatory responses that can damage the lungs, kidneys, and even the heart. And it all begins with what seems like just one bad night of sleep. Just hours. But respiratory infections aren't the only ones that take advantage of lowered immunity. The herpes zoster virus, which causes shingles, is also directly linked to stress and poor sleep. In seniors with a history of chickenpox, the virus remains dormant in the body and can be reactivated when the immune system weakens. Clinically, we often see that shingles outbreaks in seniors follow prolonged periods of insomnia or disrupted sleep, especially in patients who are caregiving, grieving, or struggling with nighttime anxiety. Another, less visible but equally serious consequence affects the body's ability to heal wounds and regenerate tissue. Poor sleep disrupts the production of growth hormone, GH, and other factors essential for cellular repair. In seniors with wounds, cuts, or pressure ulcers, sleep deprivation slows healing, increases the risk of local infection, and can escalate conditions that require hospitalization and intravenous antibiotics. This becomes especially concerning in those with diabetes or limited mobility. Therefore, sleeping well is a concrete way to boost immunity, as effective as any supplement, vitamin, or preventative medication. Sleep is not just rest, it's a critical moment of immune mobilization, during which the body organizes itself internally to defend against the outside world. Neglecting that process is like turning off the alarm system in a vulnerable house. Nothing may happen immediately, but when the intruder comes, and they always do, the consequences can be devastating. In the next segment, we'll explore how sleep quality also impacts longevity. Do people who sleep well live longer? What studies show a direct connection between deep sleep and life expectancy? And what exactly can sleep do to protect us from accelerated aging? The answers are coming up now. We live in an era where many seek the secret to longevity in exotic diets, expensive supplements, or advanced therapies. Yet one of the most powerful tools for living longer and better is something that's available every night, or at least should be: sleep. And it's not just about quantity, but primarily quality. Sleeping deeply, regularly, and with proper rhythm not only recharges the body, but activates cellular mechanisms that combat aging, protect organs, and reduce the risk of fatal diseases. In later life, sleep becomes even more critical. It's the moment when an already aging body tries to regenerate, rebalance hormones, and keep vital functions in harmony. Without that restorative sleep, longevity is shortened and quality of life quietly erodes. Large-scale epidemiological studies confirm this connection. Researchers from the University of Exeter in the United Kingdom followed over 300,000 adults over age 60 for nearly 20 years. The conclusion was clear: those who slept 7 to 8 hours per night with good sleep quality had up to a 25% lower overall mortality risk and a 35% lower cardiovascular mortality risk. In contrast, those who slept fewer than 5 hours or more than 9 with low sleep efficiency had higher rates of chronic disease, frequent hospitalizations, and accelerated functional decline. Sleep, therefore, is not merely a reflection of lifestyle. It is the biological engine of longevity. But how does sleep actually extend life? First, it reduces oxidative stress, one of the main drivers of cellular aging. During deep sleep, the body activates antioxidant enzymes that neutralize free radicals accumulated throughout the day. These unstable molecules damage DNA, accelerate tissue deterioration, and are directly linked to cancer, neurodegenerative diseases, and organ failure. Sleeping well, then, is like giving your body an army of microscopic janitors working to prevent the silent collapse of your cells. Another cornerstone is hormonal balance. Sleep regulates the production of essential hormones like melatonin, cortisol, insulin, growth hormone, GH, and leptin. This regulation is vital for maintaining an active metabolism, preserving muscle mass, controlling appetite, and protecting the mind from conditions like depression and anxiety. Without this balance, the body ages faster. It loses muscle, accumulates visceral fat, develops insulin resistance, and experiences a drop in vital energy. In short, it ages prematurely and dies sooner. Sleep also preserves cognitive function, which is directly tied to longevity with independence. A study by Alzheimer's Research UKT showed that seniors with stable sleep patterns and deep REM phases had a 40% slower rate of cognitive decline, along with a lower risk of developing dementia. And that translates into something even more valuable than simply living longer. It means living with clarity, preserved memory, autonomy, and dignity, the true definition of healthy aging. Longevity is also linked to immune and inflammatory health, two systems strongly impacted by sleep quality. Deep, uninterrupted rest helps regulate cytokine production, reducing chronic inflammation that over time damages arteries, joints, tissues, and organs. Those who sleep well have a lower risk of developing chronic inflammatory conditions, such as rheumatoid arthritis, autoimmune diseases, metabolic syndrome, and even certain cancers. And for older adults whose immune defenses are already in decline, this can mean the difference between recovery and hospitalization. And then there's the impact on emotional health. One of the most overlooked elements in longevity studies, but absolutely essential. Seniors who sleep poorly have a higher risk of developing depression, losing their sense of purpose, and becoming socially disconnected, all of which, when combined, increase early mortality risk by up to 60%, according to the World Health Organization. In contrast, those who sleep well tend to maintain more stable levels of serotonin and dopamine, neurotransmitters associated with well-being, pleasure, and emotional connection. This means that more than just extending life, sleep enhances the quality of being alive. Finally, it's important to understand that healthy longevity doesn't happen by chance. It requires routine, discipline, and attention to details many overlook, like bedtime schedules, light exposure at night, ambient silence, and sleep-wake regularity. Science has shown, unequivocally, that sleep must be treated with the same importance as nutrition and physical exercise. Those who neglect their sleep, no matter how healthy they seem during the day, are giving up years of life in the future. In the next segment, we'll address one of the most devastating consequences of poor sleep: its impact on mental health. You'll discover how insomnia directly contributes to depression, anxiety, and a loss of motivation, reducing a senior's will to engage, enjoy, or even continue living. Prepare for one of the deepest connections between body and mind. The mind ages along with the body, but its wounds are not always visible. In silence, many elderly people face long, lonely, and empty nights, not for lack of time, but for lack of sleep. And this absence, which may seem merely uncomfortable at first, gradually fuels or turns into chronic sadness, causeless anguish, and a loss of interest in life. Science has already proven, with clarity and force, that sleep is not just a biological process, but a thermometer of mental health. When sleep suffers, the mind cries out. And when we ignore that cry, we open the door to depressive and anxious disorders that consume vitality, memory, and a sense of purpose. Studies from the National Institute of Mental Health reveal that insomnia is one of the leading risk factors for developing depression in the elderly. In many cases, it precedes depressive symptoms by months or even years. In other words, the body was already asking for help through its disrupted sleep, long before the deeper sadness took hold. Sleep deprivation lowers levels of serotonin, dopamine, and norepinephrine, neurotransmitters responsible for mood, motivation, and our ability to engage with life. Without these chemical mediators in balance, the brain loses its ability to feel joy, and life becomes dull, repetitive, and colorless. For many seniors, poor sleep is the first step toward an emotional abyss. And the damage doesn't stop at depression. Anxiety, often wrongly assumed to be a condition of the young, is extremely common among the elderly, especially those with sleep disturbances. Insomnia fuels the cycle of worry. The senior lies down to rest, but the body is tense, the mind restless, the heart racing. They think of illness, of death, of their children, of loneliness. Every attempt to rest becomes an inner battle, and the more they try to sleep, the further sleep drifts away. This nighttime hyperactivity leads to elevated blood pressure, sweating, tachycardia, and nocturnal panic attacks, often mistaken for heart attacks, sending seniors repeatedly to the emergency room. The social impact is also profound. Seniors who don't sleep well spend their days exhausted, with no energy to socialize, leave the house, or maintain emotional connections. They begin to turn down invitations, avoid family gatherings, and isolate themselves. And isolation is one of the strongest triggers for depression in old age. Data from World Psychiatry show that seniors with sleep disorders are up to 80% more likely to develop depressive symptoms, especially if they live alone or have lost a spouse. Insomnia, then, is not just a personal issue. It's a silent and steady force of social disintegration. And perhaps most alarming, poor sleep significantly increases suicide risk among the elderly. A study from Stanford University found that seniors with chronic insomnia are 2.5 times more likely to experience suicidal thoughts, particularly those dealing with chronic pain, degenerative illness, or recent grief. In many such cases, emotional suffering intensifies during the night, when silence magnifies emotional pain. And since seniors often do not verbalize these feelings, the problem advances hidden until it's too late. But there is hope. The good news is that treating sleep may be one of the most effective ways to prevent and reverse depressive and anxious conditions. Cognitive behavioral therapy for insomnia, CBTI, relaxation techniques, guided meditation, well-structured sleep routines, and even phototherapy, morning sunlight exposure, have shown excellent results in seniors with mild to moderate depression. In many cases, an improving sleep quality boosts mood even before any medication is introduced. This reinforces what science has said for years. Sleep is a natural antidepressant, a side effect-free anxiolytic, and an emotional restorer that costs nothing and heals everything. In the next few minutes, we'll tackle a controversial but necessary topic: the use of sleep medications in old age. Do these drugs actually help, or are they creating a dangerous and silent dependency? What are the real risks of sedatives? When are they helpful, and when do they become traps? Get ready to understand the other side of the sleeping pill, and why many seniors are going to bed with their eyes closed and their health in danger. In the desperate search for a good night's sleep, many seniors turn to a quick fix: the well-known sleeping pill. Whether prescribed by doctors, recommended by friends, or taken on their own, thousands of people over 60 rely daily on benzodiazepines, hypnotics, or sedatives just to get some rest. At first, it seems to work. The body relaxes, sleep comes, and the insomnia disappears, or so it appears. But the truth, backed by decades of scientific research, is that this apparent solution can conceal a dangerous and silent trap. Because not all sleep is the same, and sleep induced by medication is not comparable to natural sleep. It's shallower, more fragmented, and over time it comes at a high cost in clarity, balance, memory, and even independence. The most common drugs used by seniors to sleep are benzodiazepines, such as diazepam, lorazepam, clonazepam, and non-benzodiazepines, such as zolpidem and zopiclone. These medications act on the central nervous system, enhancing the action of GABA, a neurotransmitter that reduces brain activity and induces sleep. The problem is that by doing this artificially and repeatedly, they suppress the deepest stages of sleep, especially stage N3, slow-wave sleep, and REM sleep, the most restorative phases. In other words, the person may sleep, but they don't fully recover. They wake up feeling like they barely slept, with a heavy body and a sluggish mind, as if suffering from a neurological hangover. Moreover, these drugs have a cumulative effect on the aging brain. Over time, the body builds tolerance, requiring higher doses to achieve the same effect. And when the medication is stopped, withdrawal symptoms appear: more intense insomnia, anxiety, tremors, sweating, palpitations, and in extreme cases, seizures. Studies published in the British Medical Journal show that continuous use of benzodiazepines for more than 90 days in seniors is associated with a 50% increased risk of dementia. And the damage doesn't stop at the brain. These medications impair balance, slow reflexes, and cause mental confusion, being directly responsible for nighttime falls, hip fractures, domestic accidents, and hospitalizations. The European Medicines Agency and the FDA have already issued formal warnings against the prolonged use of these drugs in the elderly, recommending non-pharmacological interventions as the first-line treatment for insomnia. Yet in practice, the opposite is often true. Seniors receive automatic prescriptions year after year, often without re-evaluation, psychological support, or any guidance on alternatives. And so thousands become trapped in a silent chemical dependency, sleeping with assistance, but living with limitations that no one attributes to the pill. That doesn't mean all sleeping medications are the enemy. In acute situations, like grief, severe anxiety, or hospitalization, short-term, well-monitored use can help a senior navigate a difficult moment. But the danger lies in chronic use. When medication becomes routine, it stops being a solution and becomes part of the problem. The brain, sensing that sleep induction is happening externally, reduces its own production of melatonin and GABA, becoming increasingly reliant on the drug. It's a process of biological unlearning. The body forgets how to sleep naturally. Fortunately, there are effective, safe, and long-lasting alternatives. The most powerful is cognitive behavioral therapy for insomnia, CBTI, a scientifically validated approach that teaches the brain how to sleep again. This therapy addresses dysfunctional beliefs about sleep, reshapes negative thinking patterns, teaches relaxation techniques, and promotes routines that condition the body to fall asleep naturally. In numerous clinical studies, CBTI outperformed medications in long-term results, without side effects. Other options include herbal remedies like valerian, lemon balm, passion flower, and supplements such as magnesium, L-theanine, and melatonin, always under professional guidance. Additionally, simple and consistent lifestyle changes make a huge difference, maintaining regular sleep and wake times, avoiding screens before bed, limiting caffeine in the afternoon, having earlier dinners, keeping the bedroom dark and quiet, engaging in light morning exercise, and getting daily sunlight. These habits, known as sleep hygiene, cost nothing but are worth everything. And unlike pills, they train the body to sleep in a natural, healthy, and restorative way. It's time to shift the narrative. Sleeping pills should not be a routine part of aging. They can be useful in specific situations, but never a long-term lifestyle. Quality sleep is a biological right, and the path to it doesn't necessarily go through the pharmacy. It goes through knowledge, discipline, and the courage to change old habits. In the next segment, we'll reveal one of the most remarkable findings of modern neuroscience, the direct link between deep sleep and Alzheimer's prevention. Get ready to learn how REM sleep literally cleans the brain and protects memory in a way no drug has ever managed to replicate. Memory, the very fabric of our identity, depends on sleep. And modern science has not only confirmed this connection, but revealed an extraordinary process that happens while we sleep. A true cerebral cleansing system capable of removing toxins linked to Alzheimer's and preserving clarity of mind well into old age. This mechanism, known as the aglymphatic system, acts as the brain's night janitor, but it only works efficiently during deep sleep, especially during stage N3, also known as slow-wave sleep. And tragically, that's the very stage that fades most with aging and sleep disorders. During deep sleep, the spaces between brain cells expand by up to 60%, allowing cerebrospinal fluid to circulate more freely, washing away the toxic waste built up throughout the day. Among these waste products are beta-amyloid and phosphorylated tau proteins, both directly associated with the development of Alzheimer's disease. When these proteins accumulate, they form plaques that suffocate neurons, block synapses, and progressively erase memory. But when sleep is deep and restorative, the brain can eliminate these toxins before they become lethal. Researchers at the University of Rochester Medical Center in the United States found that glymphatic system activity is up to 10 times more intense during deep sleep than when awake. In studies on older adults, those with fragmented sleep, sleep apnea, or chronic sleep deprivation showed significantly higher levels of beta-amyloid in their cerebrospinal fluid, even before clinical symptoms of dementia appeared. In other words, Alzheimer's doesn't start with forgetfulness. It starts with sleepless nights. Even worse, the early stages of Alzheimer's already impair the part of the brain responsible for generating deep sleep. This creates a dangerous vicious cycle. Poor sleep feeds Alzheimer's, and Alzheimer's further destroys sleep. That's why identifying and treating sleep disorders as early as possible can delay or even prevent the disease's progression. In a study from the Harvard School of Public Health, older adults who treated their insomnia experienced a 32% slower rate of cognitive decline. even among those with a family history of Alzheimer's. Another alarming discovery: sleep deprivation drastically impairs memory consolidation. The hippocampus, the brain's memory hub, depends on REM and deep sleep to transfer memories from short-term to long-term storage. When this process is interrupted, which often happens after restless nights, memories from the previous day vanish as if they never existed. And in older adults, this can mimic early-onset dementia when it's actually just the result of poor sleep. Furthermore, inadequate sleep triggers chronic inflammation in the central nervous system, a major contributor to neurodegeneration. Inflammatory cytokines can cross the blood-brain barrier, cause microlesions in brain tissue, and accelerate the breakdown of synaptic connections. So sleeping well is not just about resting. It's a nightly defense against the erosion of the mind. It's about preserving the bridge between past and present, day after day, year after year. The good news is that even seniors with mild cognitive decline can benefit from sleep interventions. Studies show that sleep hygiene practices, breathing techniques, morning sunlight exposure, regular exercise, and meditation sessions help restore portions of the deep sleep lost with age. And this recovery, even if partial, improves mood, memory, reasoning, and social interaction, offering real improvements in daily function and quality of life. That's why sleeping well is more than resting. It's resistance. It's brain armor against forgetfulness. It's how we keep the light of consciousness and identity burning bright. As Alzheimer's cases rise alarmingly, especially among the elderly, sleep stands out as one of the most accessible, affordable, and effective tools for protecting the mind. And best of all, it has no side effects, no dependency risk, and results that are both immediate and long-lasting. In the next segment, we'll answer a very common question among older adults. Do daytime naps help or hurt sleep? Get ready to discover the benefits and dangers of napping, and how it can directly affect your heart, your brain, and your nightly rest. Taking a nap after lunch might seem like nothing more than a cultural habit or a simple sign of fatigue. But in old age, this common gesture becomes a decisive factor for both physical and mental health. So does napping during the day help or hurt? As with most things in medicine, the answer is, it depends on the duration, timing, frequency, and especially on the quality of nighttime sleep. What science already knows is that when well managed, naps can improve memory, reduce stress, and even protect the heart. But when misused, they become saboteurs of night sleep, cognitive clarity, and the body's circadian rhythm. Studies from Beijing University in China analyzed the sleep habits of over 20,000 seniors aged 65 and older. The research revealed that short naps, up to 30 minutes, boost cognitive function, lower stroke risk, and improve mood. These quick naps act as brain reboots, promoting greater alertness for the rest of the day. However, the study also revealed an alarming finding. Seniors who napped more than 90 minutes a day had a 23% higher risk of developing dementia and a 36% greater risk of cardiovascular disease, even when controlling for diet, sedentary lifestyle, and blood pressure. This happens because long and frequent naps disrupt the circadian rhythm, the internal clock that regulates sleep, wakefulness, body temperature, and hormone production. When that clock falls out of sync, the body enters a reversed cycle: too much sleep during the day, insomnia at night, morning fatigue, and then more naps, and the pattern repeats. This cycle, known as sleep fragmentation, is highly detrimental to the aging brain because it disrupts memory consolidation and increases the risk of confusion and falls. Another crucial factor is nap quality. Many seniors nap in an armchair with the lights on, the TV blaring, and at random times, all of which prevent the nap from being restorative. Worse, it can lead to sleep inertia, a state of grogginess and mental fog that can last minutes or even hours after waking. Waking from a long, poorly structured nap can cause disorientation, dizziness, and in some cases, serious domestic accidents. On the other hand, when done right, napping becomes a powerful ally for brain health. A 10 to 20-minute nap after lunch enhances short-term memory consolidation, attention span, processing speed, and even learning capacity in seniors. Research from the University of California shows that people who take short, regular naps perform better on cognitive tests and have lower daily cortisol levels, which reduces oxidative stress and chronic inflammation, two major drivers of brain aging. There are cardiovascular benefits too. A Swiss study published in the Heart Journal found that older adults who took short naps once or twice a week had a 48% lower risk of heart attacks compared to those who never napped, as long as the naps didn't exceed 30 minutes. The key is balance. A nap should complement nighttime sleep, not replace it. So what to do when naps become a daily routine? The best approach is to create a controlled ritual. Right after lunch, in a dark, quiet space, with an alarm set for 20 or 30 minutes, always at the same time. Avoiding naps in the late afternoon is essential to preserve healthy nighttime sleep. And if there's a need to nap multiple times a day or for extended periods, it may be a sign of sleep apnea, depression, or a neurological disorder, and should be evaluated by a specialist. In summary, napping isn't the enemy, as long as it's short, intentional, and well-structured. It can be a balm for the brain and the heart, but when overdone, it drags seniors into a cycle of mental fog, insomnia, and functional decline. Napping during the day can help, but sleeping too much or at the wrong time can steal your night's sleep, and with it, tomorrow's health. In the next segment, we'll explore one of the biggest enemies of healthy sleep, leaving the TV on. Does falling asleep with the TV really disrupt your rest? What is the effect of blue light, ambient noise, and ongoing brain stimulation on older adults? Get ready to discover how this seemingly harmless habit could be throwing your brain into chaos just when it needs peace. Many people, especially in old age, have the habit of falling asleep with the television on, believing that the familiar noise helps them relax or feel accompanied during the night. A dark, silent room can sometimes trigger anxiety, loneliness, and racing thoughts, and the soft glow of the TV feels like a refuge, a source of comfort. But science is clear. Sleeping with the TV on doesn't just interfere with sleep. It compromises heart health, disrupts essential hormones, and accelerates cognitive decline. What seems like a harmless gesture becomes, silently, an enemy of longevity. The first major issue is the poor blue light emitted by screens. Televisions, like cell phones and tablets, emit a specific light frequency that directly inhibits the production of melatonin, the hormone responsible for inducing sleep. Melatonin is naturally released as the environment darkens, signaling the brain to slow down, lower body temperature, and prepare for rest. But when blue light hits the eyes, especially in the 2 hours before bedtime, this release is interrupted or delayed, tricking the body into daytime mode, even in the middle of the night. In older adults who already produce less melatonin, any exposure to light at night has an even more aggressive impact. But it's not just the light that harms sleep. The constant irregular sound from the television keeps the brain on alert. Even if someone appears to be sleeping, the brain continues to process noise, volume shifts, audio changes, and dialogue. This prevents entry into deep sleep, N3, and REM sleep, both essential for physical and mental restoration. Research from Northwestern University shows that sleeping with artificial light and sound at night increases the risk of obesity, high blood pressure, and insulin resistance by 74%, effects that are even more dangerous in seniors who are already vulnerable to such conditions. And then there's the content on TV, which can overstimulate the brain. Violent news, action movies, loud commercials, and even seemingly light content like soap operas or reality shows can trigger emotional responses that increase heart rate and spike cortisol levels. Even if the senior isn't watching consciously, their limbic system, responsible for emotions, continues to react to stimuli, which slows the transition from wakefulness to sleep. Over time, this pattern disrupts sleep architecture, leading to fragmented sleep, vivid dreams, frequent awakenings, and often chronic insomnia. The damage doesn't stop there. Chronic exposure to light at night is also linked to metabolic and circadian disruption, throwing off hunger cues, body temperature, and hormonal balance. In seniors, this imbalance can lead to nighttime hunger, constipation, blood pressure fluctuations, and morning confusion. A Journal of Sleep research study found that people who sleep with artificial light in the room are more likely to suffer from depression, memory lapses, and constant exhaustion, even after long hours of sleep. One more crucial detail: the partial lighting from the TV Gespaksha reduces sleep depth and increases micro-awakenings, brief bursts of brain activity that don't fully wake the person but still break up sleep quality. This fragmentation, even if imperceptible, affects cognitive functions the next day: short-term memory, attention span, balance, and motivation. And as we've seen in earlier segments, this increases the risk of falls, accidents at home, and early cognitive decline. So how do you break the habit? The first step is replacing the TV with calming bedtime rituals that don't involve harmful stimulation. Light reading, soft instrumental music, deep breathing exercises, guided meditation, or simply listening to nature, sounds like rain or birds, can help the brain enter the ideal sleep state. If silence feels uncomfortable, white or pink noise can block external disturbances without stimulating the brain. And if loneliness is the real challenge, seeking emotional support, joining senior groups, or even opening up to family members can reduce the emotional need for the TV as a companion. Ideally, one should sleep in a dark, quiet, and cool environment. This setup optimizes hormone production, respects the natural biological rhythm, and allows sleep to fulfill its essential role, restoring the body, protecting the mind, and keeping health in balance. Television is great during the day, but at night, it becomes a thief disguised as entertainment, stealing memory, energy, and in many cases, precious years of life. In the next segment, we'll show you how to create the perfect sleep-friendly bedroom. We'll build step by step the ideal space to help older adults sleep deeply, safely, and comfortably, with practical, science-backed tips you can apply to any home. The bedroom is not just another room. For older adults, it is the space where body and mind disconnect from the world, where the nervous system enters deep rest, and where the body activates its most sophisticated recovery mechanisms. But for all of that to happen effectively, the environment must be properly prepared. Sleeping well doesn't depend solely on time or desire. It depends on context. And that context begins with the space where we lay down each night. A poorly structured bedroom can turn sleep into a battlefield. Improper lighting, unexpected noises, uncomfortable mattresses, and obstacles in the way can create a fragmented, superficial, and often dangerous sleep experience. That's why creating the ideal bedroom is an act of self-care and prevention, and it can literally save lives. The first pillar is total darkness. The absence of light is essential for the brain to release enough melatonin. This hormonal production is extremely sensitive to artificial lighting. Even a small light source, like a digital clock or phone charger, can inhibit nighttime melatonin release. The ideal setup includes blackout curtains, no standby lights, and a completely dark room. If the person feels discomfort in total darkness, a very dim amber light can be used, positioned indirectly, never bluish or white, as these light frequencies deeply disrupt the onset and maintenance of sleep. The second key is controlled silence. Intermittent or sudden sounds activate the brain's alert system even during deep sleep. Car traffic, ticking clocks, standby electronics, or outside voices can all fragment rest. If the surrounding environment is noisy, partial acoustic insulation, noise-reducing windows, soft earplugs, or white-pink noise machines can be extremely helpful. And a sleep brain keeps listening and responds to each stimulus as if it were awake. The third element is the ideal temperature. The bedroom should be slightly cool, between 64 degrees Celsius and 72 degrees Celsius, 18 degrees Celsius and 22 degrees Celsius, so the body can enter the thermoregulatory state required for deep sleep. If the room is too hot, the body stays restless, trying to cool down, increasing heart rate and preventing relaxation. Excessive cold, on the other hand, triggers protective reflexes that also disturb sleep. A light comforter, cotton pajamas, and natural ventilation can help create this restorative microclimate. Physical safety in the environment is a critical factor in old age. Many seniors wake up during the night to go to the bathroom, and that's when most nighttime domestic falls occur. The bedroom should have clear walking space, non-slip or removed rugs, and grab bars near the bed or hallway. Easy-to-reach light switches, floor lights with motion sensors, and non-slip footwear beside the bed are also essential. They fall in the dark can lead to long hospitalizations and, in many cases, irreversible loss of independence. The mattress, often overlooked, is also crucial. It should be firm but comfortable, with thickness suited to the elder's body structure. Overly soft mattresses make it hard to get up and affect spinal alignment, while excessively hard ones increase pressure points and impair circulation. Ergonomic pillows that align the neck with the spine help prevent neck pain and snoring. Bedding should be breathable, hypoallergenic, and easy to clean, creating a sense of comfort and safety without causing allergic or thermal discomfort. Another often forgotten point is the whole room's scent. Light aromas like lavender, chamomile, or softwood have a calming effect on the nervous system. Moderate use of aromatherapy with diffusers or natural sachets can help reduce nighttime anxiety, ease sleep onset, and improve rest quality. But it's vital to avoid strong scents, which may trigger irritation or headaches, especially in seniors with respiratory or olfactory sensitivity. Finally, the ideal bedroom for elderly sleep should also be emotionally comforting. Family photographs, positive artwork, soft blankets, warm lighting, and the absence of visual clutter all create a tranquil atmosphere. The bedroom should be a sanctuary for rest, not a storage space for clothes, boxes, or electronics. And ideally, it should be free from screens, no TV, smartphones, or tablets at night, so the brain can clearly understand that this is a space for shutting down, recovering, and finding peace. In the next segment, we'll explore how physical exercise, even light movement, can transform sleep quality in old age. You'll discover how daytime activity is the key to nighttime rest, and why a morning walk can be more effective than any sleeping pill. Few habits hold as much transformative power in the life of an older adult as physical exercise, and among its many well-known benefits, such as improved fitness, fall prevention, blood pressure control, and pain relief, there's one that remains underestimated: exercise's ability to induce and deepen sleep. The human body was made to move. When it spends the entire day sedentary, it arrives at night with no biological reason to sleep. The brain registers no effort, sees no need to rest, and the result is a restless mind, an idle body, and poorly slept nights. Exercise is the messenger that tells the brain, "I've done my part today, now I can shut down." Science confirms this connection clearly. A study published in Sleep Medicine Reviews showed that seniors who engage in low to moderate intensity aerobic activity at least 3 times a week experience up to a 36% increase in deep sleep time and a significant reduction in sleep latency, meaning they fall asleep faster, wake up less, and spend more time in stage N3, the most restorative sleep phase. Another study by the National Sleep Foundation revealed that just 30 minutes of walking per day can improve sleep architecture in sedentary older adults. No need for intense workouts or heavy strength training. How does it work? Regular physical activity resets the internal biological clock, circadian rhythm, especially when done in the morning or under natural light. Daytime movement sends a clear signal to the brain that the day has started, raising serotonin levels, increasing body temperature, and stimulating alertness. Hours later, the cycle reverses. Body temperature drops, serotonin converts into melatonin, and the nervous system slows down, all of which creates the physiological foundation for nighttime sleep. When this cycle becomes consistent, the brain adapts, and sleep becomes naturally organized and efficient. Exercise also has a direct impact on mood and relaxation neurotransmitters. During and after physical activity, the body releases endorphins, dopamine, and GABA, substances that reduce anxiety, ease muscle tension, stabilize mood, and help the nervous system shut down more easily. This effect is especially important for seniors who suffer from excessive worry, nighttime rumination, or mild depression. Consistent exercise lowers cortisol levels throughout the day, reducing the state of nighttime alertness that delays sleep onset. There's no need, and in fact, no recommendation, for older adults to engage in intense or exhausting workouts. Simple, safe, and enjoyable activities yield better results. Outdoor walking, water aerobics, ballroom dancing, stretching, yoga, and even active gardening are effective ways to get the body moving and regulate wake-sleep cycles. The key lies in consistency and enjoyment. Forced or unenjoyable routines cause stress and don't produce the same benefits. The ideal approach is finding a practice that respects the body's rhythm, fits the routine, and brings a sense of well-being. However, timing is critical. Physical activity done too close to bedtime, especially aerobic or intense types, may have the opposite effect, raising heart rate, activating the sympathetic nervous system, and making it harder to fall asleep. That's why the best time for exercise is by late afternoon, preferably in the morning, when sunlight also helps reset the circadian rhythm. The exception includes light activities such as stretching, tai chi, or gentle walking, which can be performed early in the evening as part of a wind-down routine. Another lesser-known but vital benefit of exercise is that it helps combat excessive daytime sleepiness. When an older adult spends the entire day without physical or mental stimulation, the body enters a state of apathy, and sleep gets spread across the day in long, frequent naps, which only fragment nighttime rest even further. Exercise breaks that cycle by boosting morning energy and creating a natural sleep pressure at night, a process known as sleep homeostasis. This keeps the body in sync with natural periods of wakefulness and rest. In summary, exercise is one of the most powerful and most neglected tools for improving sleep without relying on medication. It's natural, free, adaptable, and offers benefits far beyond rest. It improves mood, preserves independence, encourages social interaction, and lowers the risk of chronic diseases. And it all starts with one step, literally. In the next segment, we'll dive into another fundamental factor for restorative sleep: nutrition. What you eat, and when you eat, can determine whether your night will be peaceful or filled with interruptions. Get ready to discover the foods that promote deep sleep, the ones that sabotage it, and how to build an evening meal that helps your body fall asleep naturally. What we put on our plate at the end of the day can be either our greatest ally or our worst enemy when it comes to sleep. In older adults, as metabolism slows and the digestive system becomes more sensitive, the choice of nighttime foods becomes even more crucial. Eating well doesn't mean eating a lot, nor eating late. It means offering the body the right nutrients at the right time, so it can rest without interference, overload, or interruption. This is especially important for those suffering from insomnia, apnea, reflux, or frequent awakenings during the night. When done right, food acts as a natural sedative, and when done wrong, as a disguised stimulant. Nutritional science has already identified several of the foods that stimulate the production of melatonin, serotonin, and GABA, the key natural sleep-inducing compounds. Among them are those rich in tryptophan, an essential amino acid that serves as a precursor to serotonin, which is responsible for a sense of well-being, and later to melatonin, the hormone that regulates sleep. Natural sources of tryptophan include eggs, chickpeas, oats, ripe bananas, walnuts, almonds, flaxseed, warm milk, and plain yogurt. When consumed up to 2 hours before bedtime, these foods help the brain transition gradually and physiologically into a relaxed state. Other sleep allies include foods rich in magnesium and vitamin B6, both of which act directly on the central nervous system. Magnesium has a calming effect, supports GABA release, and reduces nighttime muscle spasms. Vitamin B6 helps convert tryptophan into serotonin. Good sources include spinach, avocado, pumpkin seeds, sesame, salmon, and sweet potatoes. For seniors who have difficulty chewing or digesting, light soups made with magnesium-rich vegetables are an excellent option for a functional nighttime meal. Calming herbal teas also play an important role. Chamomile, lemon balm, lavender, valerian, and passion flower infusions offer mild anxiolytic effects, promote relaxation, and help quiet the mind. These teas should be caffeine-free, sugar-free, and consumed warm, never hot. They should also be taken in small amounts to avoid frequent trips to the bathroom during the night. But just as important as knowing what to eat is knowing what to avoid at night. And here lies a common mistake among those struggling with insomnia or nighttime agitation. Foods rich in simple sugars, saturated fats, and caffeine must be completely avoided in the hours leading up to sleep. This includes sweets, cakes, sodas, coffee, dark chocolate, processed meats, and fried foods. These foods spike blood sugar levels, raise cortisol, stimulate the sympathetic nervous system, and trigger a metabolic alert, the exact opposite of what the body needs to shut down. Alcohol, often used as a form of relaxation, is also a hidden enemy of sleep. Although it may cause initial drowsiness, it disrupts the sleep cycle, suppresses REM and deep sleep stages, increases nighttime awakenings, and reduces oxygenation in the brain. The result is fragmented, shallow, and non-restorative sleep. Moreover, alcohol is a diuretic and increases stomach acidity, contributing to acid reflux, heartburn, and abdominal discomfort, especially harmful for older adults. Another key point is the timing of the last meal. Eating too late forces the body to continue digesting during sleep, preventing full relaxation. The ideal evening meal should occur 2 to 3 hours before lying down, and it should be light, nutritious, and easy to digest. For those who eat dinner early and feel hungry before bed, a small functional snack is recommended, such as a glass of warm milk with oats, a banana with flaxseed, or a slice of whole grain bread with chickpea spread. Nighttime reflux is one of the leading causes of sudden awakenings in older adults. It can be prevented with head-of-bed elevation, use of an ergonomic pillow, and reducing acidic foods at night, such as tomatoes, citrus fruits, bell peppers, and red sauces. It's also essential to avoid lying down immediately after eating. Waiting 30 to 60 minutes allows the stomach to begin digestion safely. In summary, nighttime eating can be a sedative or a poison for sleep. Eating well at night means choosing ingredients that communicate with the brain, signal relaxation, balance hormones, and prepare the body for full shutdown. Eating poorly overstimulates, burdens metabolism, activates digestion, and leaves the mind only half asleep. To sleep well, you have to start long before bedtime, beginning with what's on your plate. In the next segment, we'll show you how to create a simple and effective nighttime ritual that teaches your body to fall asleep naturally, night after night. You'll understand why the right habit, done at the same time every day, can be more powerful than any sleep medication. If during the day the body obeys the mind, at night it is the mind that must obey the body. And for that to happen, the body needs clear, repeated, and consistent signals that it's time to shut down. Human biology works through association. We are conditioned to repeat patterns that signal what comes next. Just as dimming the lights and making popcorn prepare the brain to watch a movie, certain actions repeated every night before bed teach the brain to associate that moment with rest, safety, and disconnection. This is what we call a nighttime ritual, a sequence of simple, consistent behaviors that naturally and gradually induce sleep. Lack of routine is one of the greatest enemies of healthy sleep. When every night has a different time for dinner, screen use, bedtime, or light exposure, the brain loses the reference points of the circadian rhythm and it doesn't know when to start producing melatonin. That's why the first step is regularity. Going to sleep and waking up at the same time every day, including weekends, resets the biological clock and strengthens sleep hormones. In older adults, this consistency is even more important, as the body responds better to stable routines and suffers more from abrupt changes. The ritual should begin about 60 to 90 minutes before the usual bedtime. This is the moment to reduce stimuli, slow down cognitive activities, and signal to the body that the day is winding down. A warm, not hot, shower helps to gradually lower core body temperature, simulating the natural cooling process that precedes sleep. This thermal drop is one of the most powerful triggers for initiating sleep. After the shower, changing into soft, loose-fitting clothes sends another clear message to the body that it's time to rest. Next, the environment must change. Bright lights should be turned off and replaced with dim, amber, or yellow-toned lighting. Avoid screens, no phones, tablets, or TV, as the blue light from these sources suppresses melatonin and activates the cerebral cortex. Instead, try light reading, calming music or nature sounds, guided meditation, breathing exercises, or personal prayer. The activity should bring comfort, predictability, and a sense of safety. Avoid heavy topics, sad news, or tense conversations during this time. Another powerful tool for calming the nervous system is a conscious breathing. Techniques like the 4 to 7 to 8 breathing pattern, inhale for 4 seconds, hold for 7, exhale for 8, Stimulate the vagus nerve and place the body into parasympathetic mode, the biological rest and digest state. Repeating this for 3 to 5 minutes while lying in bed or seated lowers heart rate, reduces cortisol, and induces sleepiness in just a few minutes. Seniors who adopt this practice report faster sleep onset and fewer nighttime awakenings. Other optional elements may be added to personalize the ritual. Soothing aromas like lavender or chamomile, foot massages, warm compresses on the abdomen, or even lightly weighted blankets that provide a sense of containment and calm. The most important factor is that the ritual be pleasant, repeatable, and easy to maintain. Overcomplicated or unpleasant routines won't stick, and consistency matters more than intensity. It's also essential to avoid stimulating behaviors during this time. Arguing about family issues, making financial decisions, replying to agitating messages, or scrolling through social media will activate the brain's alert mode, the exact opposite of what you want. The nighttime ritual should be a moment of retreat, silence, and self-care. It must be treated as a commitment to one's own health. Even when sleep doesn't come right away, the ritual should not be broken. Patience is part of the brain reconditioning process. Over time, the brain will learn to interpret that sequence of actions as a biological command to rest. And when that association is made, sleep comes automatically, not by force, but by habit. That is the key to sleep hygiene, teaching the body to sleep without pressure, showing the way without demanding it. In the next segment, we'll talk about when insomnia stops being just a nuisance and becomes a clinical condition that requires medical attention. You'll learn to recognize red flags, clinical criteria, and when it's time to consult a sleep specialist. Everyone has bad nights once in a while. Excessive heat, a stressful situation, a heavy dinner. Any of these can disrupt sleep for a night or two. But when poor sleep stops being the exception and becomes the rule, it's time to raise a red flag. In older age, it's common to hear that bad sleep comes with age. But this belief is a dangerous myth because it normalizes a form of suffering that can and should be treated. Chronic insomnia is a medical condition recognized by doctors, classified by psychiatry, and defined by clear clinical criteria. And the earlier it is treated, the better the chances of regaining quality of life. Insomnia is considered chronic when a person experiences difficulty falling or staying asleep at least 3 times per week for a minimum of 3 months. And especially when this causes significant daytime impairment, constant fatigue, low energy, memory lapses, irritability, increased risk of falls, difficulty concentrating, and persistent low mood. Often, older adults don't realize they are ill. They simply say they don't sleep like they used to, or that they wake up tired every day. But in reality, they are experiencing a clinical condition that affects the entire body, including the immune, cardiovascular, and nervous systems. There are different types of insomnia. Initial insomnia refers to trouble falling asleep, taking more than 30 to 45 minutes to do so. Middle insomnia involves frequent awakenings during the night. Terminal insomnia happens when someone wakes up far earlier than desired and cannot fall back asleep. Many seniors experience a combination of all three, creating an extremely fragmented and non-restorative sleep pattern. In such cases, a precise diagnosis is crucial to distinguish between normal sleep variation and a true disorder. This is where seeking specialized help becomes essential. Doctors such as geriatricians, neurologists, psychiatrists, and sleep medicine specialists are trained to investigate the root causes of insomnia. Often the disorder is just a symptom of something deeper. Anxiety, depression, sleep apnea, restless leg syndrome, chronic pain, side effects from medications, or undiagnosed hormonal imbalances. Simply treating the symptom with sleeping pills without addressing the cause is like painting over a wall that has water damage. The problem comes back, worse and deeper. One of the most effective diagnostic tools is polysomnography, a sleep study performed in a lab or at home that monitors brain waves, heart rate, oxygen levels, movement, and breathing interruptions. It can detect obstructive sleep apnea, micro-awakenings, nighttime teeth grinding, neurological disorders, and even silent seizures that occur only during sleep. In many cases, Polysomnography reveals that the patient never even enters deep sleep, explaining why they feel tired despite sleeping 7 or 8 hours. Sadly, many people resist seeking help out of embarrassment, fear, or misinformation. Some believe it's pointless to go to the doctor for sleep. Others fear being diagnosed with dementia or being forced to take medication. But today, the medical approach to insomnia has advanced significantly. The focus is on sleep education, environmental adjustments, behavioral interventions, and personalized care. And when medication is truly needed, it can be prescribed in minimal, safe doses with close monitoring, always prioritizing clarity of mind and quality of life. What matters most is understanding that suffering from insomnia is not weakness, nor fussiness, nor a natural part of aging. It's a treatable, reversible condition that, when ignored, can lead to far more serious problems like silent heart attacks, serious falls, acute confusion episodes, and treatment-resistant depression. Seeking help is an act of courage, and choosing to sleep well is ultimately a choice to live more clearly with more energy and more quality time with the people you love. In the next segment, we'll hear real stories from older adults who transformed their health just by changing the way they sleep. Stories of recovery, renewed life, and personal rebirth, all of which began with a pillow. Moving, real, and absolutely possible. Science explains it, the data confirms it, but it's the real-life stories that touch the heart. At this point in the video, it's time to show that everything we've discussed so far isn't distant theory. It's possible transformation. What follows are true testimonials from people over 60 who experienced firsthand the impact of poor sleep and, through small changes, rebuilt their health, memory, vitality, and even emotional connections. These are stories of quiet resilience, daily courage, and lives that began to bloom again, all starting with sleep. The first story comes from Mrs. Lourdes, 73, retired, living in Belo Horizonte. For almost 10 years, she barely slept. She would wake at 3 a.m., toss and turn, feel drowsy all day, forgetful and too tired to leave the house. Her family suspected early dementia, but after visiting a sleep neurologist, she was diagnosed with intermediate insomnia, worsened by long-term clonazepam use. The doctor began gradually tapering the medication and introduced sleep hygiene techniques. In under 3 months of stable routine, morning walks, light reading before bed, and a small dose of prescribed melatonin, Mrs. Lourdes began sleeping 7 hours a night again. Today, she takes dance classes, travels with her children, and says, "My memory came back. I wasn't getting Alzheimer's, I was just exhausted." The second story is about Mr. Milton, 68, a retired teacher from Recife. He had 2 heart attacks in under 5 years, despite eating well and keeping his cholesterol in check. It wasn't until a more thorough cardiology checkup that the doctor suspected sleep apnea. A sleep study confirmed it. Over 40 breathing interruptions per hour. With the use of a CPAP machine and sleep re-education, the snoring stopped, his blood pressure stabilized, and his energy returned. Today, Mr. Milton says, "I thought I was getting old. It wasn't my age. It was the lack of air at night that was silently killing me." We also have the story of Howie, Mrs. Zuleide, 75, a widow from São Paulo. She suffered from deep sadness, apathy, irritability, and nightly crying spells. She went through 4 depression diagnoses and numerous medication changes, but nothing truly helped. It wasn't until she spoke with a psychologist specializing in sleep that she discovered her insomnia was caused by nighttime anticipatory anxiety, worsened by grief and lack of routine. The professional helped her develop a nightly ritual: chamomile tea, a gratitude journal, reading, and 4 to 7 to 8 breathing exercises. Within 2 months, Zuleida was smiling again, attending her church's senior group and painting once more. She says, "I just needed one peaceful night to remember who I was." Then there's Carlos, 62, an electronics technician from Porto Alegre. After the pandemic, he began staying up until 4 a.m., watching shows, eating at odd hours, and sleeping with the TV on. He gained 15 kilos, developed prediabetes, started forgetting tasks, and lost an important contract due to a memory lapse. After a checkup, his doctor recommended he see a sleep coach. Carlos made small changes. He stopped consuming caffeine after 3 p.m., started eating dinner earlier, turned off all screens by midnight, and swapped TV for white noise. 3 months later, his test results improved, he lost weight, and his memory returned. Today, he says, "It's not dieting that changes your life. It's sleep. When you sleep right, everything changes." These stories, real, moving, transformative, show that it's never too late to recover sleep or to rediscover yourself. A pillow can be a tomb of anguish or a cradle of rebirth. And in old age, more than ever, sleeping well is a cry for autonomy. It's the active choice to live with energy, clarity, health, and dignity. Science has already proven it. But it's these people, ordinary, anonymous, just like any of us, who show that everything begins when the night becomes an ally. In the next and final segment, we'll bring together all the information in a strong, clear, and definitive conclusion. You'll understand why the sleeping well after 60 is not a luxury, it's a necessity, and why caring for your sleep may be the most powerful decision you make in your later years. Throughout this journey, we've seen that sleep is not just rest. It is repair, prevention, clarity, and life. Every sleepless night isn't just fatigue, it's a debt, one that the body repays with high blood pressure, silent heart attacks, mental confusion, memory loss, uncontrolled diabetes, and even the risk of premature death. And contrary to what many still believe, poor sleep is not a natural part of aging. It's a warning, a cry for help from the body, a signal that something needs to change, and that there is still time to change it. Sleeping well is not a luxury nor a whim. It is a matter of survival. It's what separates a dragged-out day from one lived with vitality. It protects the heart, shields the mind, strengthens the bones, and renews hope. Deep sleep is the body's secret hospital, where hormones rebalance, tissues regenerate, neurons are cleansed, and the immune system prepares for battle against everything that could harm us. And this renewal happens every night, if you allow it. If you respect sleep, it gives you life in return. Science no longer has doubts. Older adults who sleep well live longer, with more clarity, more independence, more energy, and fewer medications. And the path to restorative sleep doesn't require surgery, money, or miracle formulas. It requires routine. Morning sunlight, light walks, a gentle dinner, a dark room, a silent ritual. And above all, it requires choice. Choosing not to sleep with the TV on. Choosing not to overload your body with caffeine. Choosing to treat the last hour of the day with the same care as your morning coffee. If you've made it to this point in the video, you've already taken the first step. The next step is to take action, to look at your sleep with respect. And if you can't do it alone, seek help. There is no shame in saying, "I can't sleep." There is courage, because taking care of your sleep is taking care of your mind, your heart, your immunity, and your story. An elder who sleeps well has less fear, less pain, and more clarity to keep living with dignity. Remember, you were not made to live tired. Fatigue is not your destiny. Sleep is the place where everything is reorganized, where the soul finds peace, where the body heals, where tomorrow begins with strength. So take care of your sleep as you would take care of your own life, because that's exactly what's at stake.